Record numbers of children have been hospitalized with COVID-19 over the past month in 13 states. Predominantly in the South, an analysis of federal data shows, as skyrocketing infections fueled by the hyper-infectious Delta variant raise concerns about the start of the school year. Influxes of sick children are being reported in a growing number of other states across the country. Major children's hospitals in California, Colorado, Kentucky, New Jersey, Tennessee and Wisconsin have all confirmed increasing numbers of pediatric inpatient volumes. This isn't necessarily because the Delta variant causes more serious illness, but because of the sheer volume of cases it is driving among children, who are largely unvaccinated. Kids under 18 are making up an increasingly large proportion of all new coronavirus cases, with nearly 100,000 testing positive in the last 2 weeks of July, according to a report from the American Academy of Pediatrics. This sum accounted for roughly 15% of all newly reported COVID-19 cases across the nation and marked a 31% increase over the roughly 72,000 cases reported the week prior, 1,450. That's how many children were hospitalized in the US as of Sunday, the largest number so far in the whole pandemic, National Institutes of Health Director Dr. Francis Collins told ABC News this week. The surge in coronavirus hospitalizations among children is also being exacerbated by a rise in cases of respiratory syncytial virus, or RSV, a contagious seasonal flu. While RSV infections typically surge during the winter flu season, experts say the respiratory infections are likely increasing now because masking and social distancing to prevent COVID-19 infections delayed the normal RSV season. The CDC reported historically low levels of RSV while there were strict safety precautions in the US, but now people are relaxing and increasing contact with the pathogens that weren't spreading as much earlier on in the pandemic. Pediatricians are sounding the alarm about the impact of these dual surges on their facilities. We are unfortunately at war right now in the pediatric population in terms of viruses, Dr. Kelechi Iheagwara, who works at the Our Lady of the Lake Children's Hospital in Louisiana, told CNN on Wednesday morning. We have a significant increase in the number of COVID-19 positive children that come through our ER. We are seeing kids of all ages, from 3 weeks of age to 17. How these trends will impact the school year as children start to make their return to in-person teaching. Many public health officials have been stressing the importance of mitigation measures